plastic surgeon. I'm Dr. Nicholas Jones. I practice in Atlanta, Georgia. And I like your platform, and I thought it was very interesting and also very helpful to patients. So just before I start, I do have a disclaimer. So anything that I say today, this isn't medical advice, and it only can be medical advice once you come into the office and actually had a consultation with a plastic surgeon or any sort of doctor, and they've been able to perform a physical exam.
Doctor, can you try to talk a little bit louder?
Can you hear me? How's that? Is that better?
That's way better, thank you.
Okay. So so do you want me to repeat myself?
You can repeat yourself, reintroduce yourself, and
Yeah.
you can read the questions and answer them, and get started with the topic, and then people will have more questions.
Okay.
So let's make sure you follow him too, and thank him for his time today.
Okay, so again, I'm Dr. Nicholas Jones. I'm a plastic and reconstructive surgeon. I practice in the Atlanta area, and mostly what I do is cosmetics, breast and body. And I decided to come on your platform today because I think it's very helpful to educate patients or prospective patients so they can at least have an idea of what to expect and just be more informed. And so today we're going to talk about Brazilian butt lifts, which is a very popular procedure here in the States and as well as abroad. And basically BBL, Brazilian butt lift, it's also, some people call it BBT or Brazilian butt transfer. And basically what it involves is liposuctioning from various parts of your body, typically the trunk or the abdomen, the flanks and the back. And instead of getting rid of the fat, take the fat and we place it into the buttocks to give a more enhanced look of the butt as well as the curves. Can you tell me when there's a question?
Okay, there's questions.
Okay.
So the first question, do you have the BMI requirement for BBLs?
So that's a great question. I do not have a BMI requirement per se because every patient is shaped differently. Like you may have a high BMI, but you may have a great contour. But generally speaking, I like to keep the BMIs less than 30. The most that I'll do is 35 at the max. And the reason being is usually when the patients are heavier or obese, it's more difficult to get them a great result. And I don't want to give patients false pretenses that they can come out with a Nicki Minaj butt, and then they typically require other procedures like a tummy tuck in addition to the liposuction, but even more so, if they have a high BMI, I think the best solution or a great place to start would be to lose weight and weight loss and dieting.
Next question.
Okay.
How long should we wear compression socks?
Compression socks?
Yes.
That's a good question. I would say, I mean, there's no great answer, but I say continue to wear the compression socks until you're walking, like walking without difficulty and you've recovered.
All right. Next question. Is it okay if we take Dr. Sebi's cell food for hemoglobin?
Take what?
Dr. Sebi's cell food for hemoglobin.
I don't know what that is, but my feeling about supplements is that to make sure you inform your doctor prior to your surgery of any medications that you may be taking, because some of them do have some bad side effects which can cause increased bleeding after your surgery.
Next question. Have you worked with burn survivors when it comes to reconstruction?
I have worked with patients who had burns.
Next question. Do you replace the fat under the muscle or on? What is better?
That is a great question. So, in the plastic surgery world, in the cosmetic world, there's been a lot of debate about where the fat should be placed. And there's actually been numerous deaths as a result of Brazilian butt lifts. And most of those deaths, after they've done the autopsies, it has been shown that placing the fat within a muscle or beneath the muscle has a higher incidence, or it's associated with deaths. And basically what happens is when the fat's placed under the muscle, there's blood vessels there. There's the arteries and the veins. And if the fat gets into the veins, it can go into your vena cava, or your bloodstream, and go into your lungs, and it can end up being fatal. And that's called a fat embolism. And actually the plastic surgery, the American Society of Plastic Surgeons has put out a safety recommendation, and it's recommended that the fat only be placed in the subcutaneous tissue.
Next question. Is contouring and the lymphatic drainage massages different?
Contouring is a way in which we perform liposuctioning. Basically, liposuctioning, when you remove the fat, you're contouring the body. Lymphatic massages is something that is done post-operatively to help expedite the healing process, and also to help out with the fluid drainage, and to get you just a faster recovery.
When can we sit down after a BBL?
It just varies. Depends on your plastic surgeon. I usually try to get my patients to stay off their butt as long as possible, with the minimum being about 6 weeks. And so what most patients can do, they buy a booty pillow, and with the booty pillow, the pillow is placed underneath the thighs, so there's no pressure on the buttocks. And for me, I think, which is even more important, is wearing appropriately fitted garments, because I believe the garment helps out with the final shape.
All right. Is there a liter limitation in the state of Georgia? For instance, in Florida, doctors can only remove 4 liters during a BBL.
Wow, these patients, y'all know a lot. So in Georgia, the maximum that you can take out in the outpatient setting is 5 liters. And so if you're on the cusp of taking out more, the patient is supposed to be admitted to a hospital for overnight stay. And the reason why there are limitations is that even though you're removing fat, when you're removing those fat particles, there's also a blood component in it. And surprisingly enough, if you were to check someone's hemoglobin after you remove 5 liters of fat, the hemoglobin does drop significantly.
If there's red liquid, I think they're referring to as blood, during lipo instead of the gold, which I think they're referring to as fat.
Right.
Does that mean they're doing the lipo wrong?
No, not necessarily. There's multiple factors with that, and one being the amount of tumescent. So you put in fluid, which is usually a combination of normal saline, lidocaine, and epinephrine. The epinephrine is used to cause the blood vessels to constrict. So if you by causing blood vessels to constrict, there's less likelihood of having blood within the aspirate or the fat that you suck out. And so if you don't use a lot of fluid, you're more likely to have a bloody aspirate or liposuction fluid.
Someone said, when can you start weight training? I see some people start the day after surgery, but some doctors don't recommend it.
I tell my patients to hold off on any weight training for at least 6 to 8 weeks. It's fine for them to walk, but I just recommend no strenuous activity until they completely heal. And usually around the 6 to 8 week point, the inflammation has resolved, and the swelling is much better, and the wounds have healed up.
Why would some say do a tummy tuck first, than a BBL. Wouldn't you want to get all that fat out with the BBL/lipo 360 first?
I think it's just a surgeon's preference. I think the advantage of doing the tummy tuck first is if you do the tummy tuck and then there's some areas where there's some contour irregularities, you can address those and then go ahead and do the BBL. Disadvantage is you do the tummy tuck, you wasted or discarded a lot of the potential fat that you can use to inject into the buttocks.
Someone said, I did a BBL and it's like I didn't do anything. I don't see the butt. Can you tell what happened and what can I do?
So I can't tell what happened because I haven't seen you, but when you do put the fat into the buttocks, all of the fat doesn't survive. So generally speaking, I would say about 60 to 70% of those fat cells do survive. And even right after the surgery, your butt may be huge. And part of the reason it's huge is some of it's inflammation, some of it's fluid that was injected along with the fat. And, over time, sometimes, everybody heals differently. For whatever reason, perhaps your fat just didn't take well.
Next question. What is your hemoglobin requirement?
It just needs to be within a normal range.
Someone said, can a person that has a hip replacement get a BBL?
Yes, they can have a BBL. I wouldn't say that was an absolute contraindication.
Do you have/use an ultrasound machine to help with the BBL fat injections?
So the ultrasound machine, there's various types, but one that's very popular right now is called Vaser. And the Vaser machine isn't used to inject the fat. The Vaser is used to suction out the fat. And what it can do, what it does is you can have better contouring results. It's a heated source, and so it's using the ultrasound. It helps melt the fat away, and you can get very excellent results in appropriate patients. And most people are using it for abdominal sketching. Like if you wanted to create abdominal muscles or highlight certain areas, it can be used for that.
Someone said, how long would you recommend we hire a nurse for after surgery if staying in an Airbnb?
I don't really have a good answer for that. I just think that it sounds like someone who's hiring a nurse and they're staying in an Airbnb means that they've traveled or some sort of medical tourism. I would just make sure that the surgeon who's doing their surgery is qualified and that they have appropriate follow-up, and I would always have some sort of chaperone. But as far as the length of time, I mean, some patients don't have a nurse to stay with them. They just have a chaperone. They follow up with their doctor at whatever time that they've designated. And there's usually, what I personally do is I have a number for patients to call in an event that they have an urgency or emergency, or they just have a question. They can contact our nurse practitioners.
Someone said, can a person who has a rotator cuff tear near the shoulder get a BBL?
Yes.
Okay. What are the pros and cons of using drains with a BBL?
The pros of using a drain is that it helps the fluid egress. So more than likely, the period of swelling would be minimized. One of the cons of using a drain is it's a foreign object, so it could actually be a nidus for infection if it's left in too long. It can also, your body can form a capsule around the drain, and a patient could potentially develop a seroma. But drain usage is a surgeon preference.
Some people say the fat in the hips doesn't stay. How can we as patients help fat stay?
By wearing your garment and not laying on the area where the fat was injected.
What do you think about the fluffy fairy? How can we help our fat stay? The bluff, she said the butt fluff. How do we feed the fat?
Wait, say that. I didn't get that question. Can you repeat that for me?
I guess she was basically saying how can we help our fat stay in the areas.
Again, I think staying off of this is just my own personal opinion, but I don't know if there's any science behind it. But I think having a garment that fits appropriately and staying off your butt, because if you sit on your butt right after your surgery, it could potentially cause a deformity. It can flatten out the area, and it's not like we're putting in an implant. So the way that the fat takes is highly predictable on your body shape and your buttocks capacity to hold in the fat. Like, everybody can't get the same amount of fat injected. It just depends. It just varies with the patient. You may have two patients who look exactly the same, have exactly the same shape, and one patient I may be able to put in 1,000 cc's in each butt cheek, and another patient she may only be able to take 600 cc's.
All right. If there isn't enough fat in around the body to create the butt the patient wants, where do you get the fat from?
I mean, you can take fat from anywhere in the body. Sometimes I've taken it from the arms, the inner thighs, the back, everywhere. But if a patient doesn't have enough fat, then they just have to be willing to accept the fact that they may not have the result that they want. And if that's the case, there's other options. There's butt implants, which some surgeons offer, but I specifically don't. I don't do butt implants.
Someone said, is Cell Saver worth it, or is it just a way to get more money from us? Some BBL patients allegedly needed blood transfusion even after using Cell Saver.
I think it's a surgeon preference. So generally speaking, like I said, before you have any sort of surgery, you see your surgeon prior to the surgery, have a workup. We check labs, and if their hemoglobin is within a normal range, they typically, and they don't have any underlying medical conditions, they're stable, having the surgery shouldn't cause a significant drop in the hemoglobin to the point where they need a blood transfusion. I've never had to do a blood transfusion. So I don't use Cell Saver.
Someone said, is there less chance of fat embolism if fat is transferred just to the hips and not the butt?
Yes, I would say so, because when you're transferring the fat to the hips, you're completely avoiding the muscle. The danger with Brazilian butt lifts is when the fat is injected into the muscle, whether it's intentionally or inadvertently.
Can you use something to create back dimples after surgery as well?
You can. It's just the technique in which you perform liposuction, and then there's other adjuncts that are available to kind of help with the contouring.
Do you believe in feeding the fat? If so, what should we eat to feed it?
I don't believe in feeding the fat. I don't know. If you can tell me what is it, I don't know. Maybe some of the silhouettes know. Have you heard of that before? I've never heard of that.
Yeah, so like basically feeding the fat is where basically essentially like you just don't go on a crash diet. I mean, some doctors, this is a surgeon specific, will actually tell silhouettes to increase their fat intake so that way it can help the chances of the fat surviving. So yes, that's something I've heard before.
Okay. I don't think there's any science behind that, but I've had patients who come to me and ask me if I thought they should gain some weight prior to surgery so that they could have more fat. And my take on that is don't do it. If it's that if it's that serious, then it's probably not a good choice. I think that performing a BBL is just as, like, what you take out and where you take out the fat is just as important to where you're placing the fat. Because sometimes I have patients, I think they have a great result, would have a great result if I just, even after I've just completed the liposuctioning, because it's sort of a like an enhancement, basically when you take the fat out, most of the work has been done. The putting the fat in is kind of like icing on a cake.
Do you want any fun questions?
Yeah, let's do some fun questions.
Someone asks, are you married?
You know what? That's a great question. I'm not married. I've never been married. I have been in love a few times, but as of today, July 12th, 2019, I am not married.
Okay, someone said, why is he so handsome when he smiles?
You know what? That means a lot to me. I think it's because I got a couple of friends. They're dentists, and they try to keep my appointments up to date. My cleanings. I'm due for a cleaning, so hopefully I can get in to see one of my buddies, and they get me right.
Someone said your smile is feeding the fat.
You know what? I'm gonna continue to feed the fat. And it sounds like we're ending things, but what? You have another question? I just have a comment. Can I make a comment?
Yeah.
I mean, we can stay on, doctor, as long as you want to.
Okay.
There's a lot of questions.
Just let us know when we're good.
Okay. Go ahead.
There's
Go
a lot
ahead.
of questions. Okay, so another question is, what would you recommend for lightening the scars?
Lightening the scars?
Mm-hmm.
That's a great question. So usually a healing process can take anywhere to 6 months to a year. And so I usually wait until like about 6 months. And then if there's a patient and they have a hyperpigmented scar, there's some products over the counter or some prescriptions that you can use. And one is hydroquinone. And basically it's a bleaching agent that you can put on your scar. Does it work? Sometimes. In African Americans, I think it's okay. I would be a little cautious with the use of lasers in patients who are darker skinned.
Someone said, does smoking affect your results?
Yes. I tell patients, anytime you have an elective procedure, I always recommend that you stop smoking at least 4 to 6 weeks prior to the surgery, because the effects of nicotine on wound healing are well described, and it can cause some skin necrosis or poor wound healing, especially in patients who are undergoing like major operations like tummy tucks. For me, if I find out a patient is an active smoker, I won't offer them a tummy tuck.
Someone says, what are your thoughts on surgeons snapping their surgeries on social media?
I think it's okay. I don't have a problem with it. I do it sometimes, and you just have to be respectful of the patient and inform them prior to the procedure. They have to give their consent, and if they don't want their surgery filmed, I don't film them. But I do have a problem. I'm not going to say a problem, but I think it's a very fine line, because medicine is a profession. And so even though you may be in an operating room, you may be having a good time, but there's a certain level that you have to maintain. I don't think you should take any sort of surgery lightly, whether it's like a tummy tuck or you're just removing a skin lesion from someone's hand. Complications happen, and you just have to maintain a certain level of professionalism.
Okay, so we have like 3 more questions.
Okay.
Someone says, what's the best way to sleep comfortably after BBL?
I don't know. Maybe our host can answer that question, because I haven't had the procedure. I know some patients who they think it's difficult to sleep on their stomach. So what they'll do, I think that's the best option. you can put a pillow under your hips so that you're a little bit more comfortable, but I don't recommend you sleep on your back or on your side, especially if you've had fat injected into your hips. What's your thoughts? Oh, it paused.
So like sleep on their knees and hover over the bed. So it's uncomfortable, but some people make that uncomfortable adjustment so that way, you know, they can stay up their butts for as long as possible.
Okay. What else? What else you have for me?
Can I donate my fat to someone so they can get a BBL?
No, you can't.
Alright.
What else? That's it.
And someone said, I think that's
Yeah,
it. Oh,
so-
how are we, one more. How are we supposed to properly clean our incisions? No one ever says, can we use Q-tips or what?
Oh, the incisions. So I leave some of the incisions open so it can drain, but typically 24 hours after your surgery, I say it's okay for you to shower, get it wet, pat it dry. You really shouldn't have to do anything with the incisions. Sometimes some doctors leave steri strips on, and those usually stay on until they fall off. But the incisions are very small with the liposuction sites.
Alright.
Yeah. So again, I just wanted to thank you for doing what you do to keep patients informed. I also want to thank my team, Johnson and Carl. And I again thank you. But this one other thing I just wanted to share with you.
What? There's actually one important question.
Wait,
I think we
wait,
should answer.
we'll get to it. We'll get to it.
Okay.
But let me just finish. So, when you perform as a surgeon, the worst thing that can happen for me is that a patient have a complication, or a patient have a result that they're not happy with. Because an unhappy patient makes me an unhappy surgeon. And so, if you do anything like over and over again, like the more you operate, the more likely, the higher likelihood you are to have a complication. So I think sometimes, I've seen on your page that you show complications, and which I think that's fine because people need to know that there are risks involved with these surgeries. But sometimes patients have complications and no one's really at fault because, like I said, it's just the nature of the business. But what's important for patients is that when you're looking for a surgeon, you find out that they have a good track history. Like if you're one of those patients and you're unfortunate and you end up having the complications, you need to be confident and know that the doctor that you've selected is going to be there for you to take care of you throughout that entire process.
So here's one last question.
What's that?
Why do some patients look like they had better lipo when they go to a particular surgeon sometimes out of the country? They have a snatched look, but then the U.S. doctors can, only take out 4 liters and stuff.
I don't really think it's about how much they take out. Just like anything else, some surgeons are better than others, and some candidates are better patients than others. Like, for example, if you have to be able to compare apples to apples and oranges to oranges. So let's say me as a plastic surgeon, let's say all of my patients are healthy. All of my patients have a BMI like that's under 28. More than likely, my results will be better than a surgeon who takes care of patients with a wider variety of weights and medical conditions. So all those things have to be taken into account, but every surgeon is different, and all surgeons aren't created equally. So some are better than others, some are better at certain procedures. You just have to vet them and find someone you feel comfortable going to.
That's it. They already did a lot.
We're totally fine. Like whenever you're ready.
You have more questions? Okay.
If you want to talk about anything else, that's fine too.
No, we're gonna still talk about BBLs. Let me take on how long have we been on now?
30 minutes.
Let's take like 4 more questions.
Okay.
Oh, let me show you my little mug. You see this? My Steven, she's like my second mother. She bought me this. It's nice, right?
Yeah, motivational.
Yeah. You know what? Let's talk. Can we talk about basketball a little bit for a couple of seconds? Are you a basketball fan?
No, I'm not a basketball fan, but maybe the silhouette. No,
You know what? They don't care. I wanted to talk about Russell Westbrook a little bit, but it's fine. Let's just keep it nice.
Okay, so everyone's like, oh, y'all need to let him go. Well, some people said, when can you drink after a BBL?
Like alcohol?
Yeah.
I think I would say once you're off the narcotics.
Mhm.
Yeah. Don't drink and drive. It's not a good thing. What else? Ask me if they want me to sing, because I can sing.
Here's one thing. What kind of questions do we need to ask surgeons before having a BBL?
Oh, that's a great question. Here, you can ask them, like, where do they do their surgeries? Is there an anesthesiologist involved? Where do they have hospital privileges? If they don't have admitting privileges to a hospital, that's a red flag. That's like a big red flag, because that means that they're probably not a plastic surgeon. And that's not to say like that other types of doctors can't have great results. It's just if I was going to have something done, I would want to make sure that the person who's doing it is doing it in the safest way possible.
How safe are Brazilian butlers?
I think it's safe in the hands of a qualified surgeon. There was recently a report that came out, and the death rate that they reported was approximately, it was like 1 in 3,000, and that's high. That is like extremely high with any sort of elective procedure. But part of the problem is there's all sorts of people performing these surgeries. Some of the people who are performing the surgeries are unqualified to do them. And so until they get a handle on that, you can't really get a good mortality or death rate from the procedure.
Okay, and then why are Miami doctors significantly lower than any other state?
Well, it's just basic economics. It's supply and demand. So if you have a high demand for a procedure and you have a whole bunch of surgeons, their price has to go down, or they won't be able to compete.
Okay.
Did I say that right? Did I mess that up? Mess that up?
Yeah.
That was right?
Yeah, it was good.
Okay, good.
Okay.
Perfect.
How can we get a free consultation?
Free consultations, they can call the office. It's 404-400-1230. Extension whatever it says on
Repeat the number?
whatever it says on my my bio thing.
Yes.
But the problem is that I'm gonna just tell you up front. Sometimes they take some time to get back to you. So one way you can reach out to me is you can DM me, or you can also go to the website and fill out the contact information.
And then last question.
Last question.
Can you sing now?
Can I sing? I sing because I'm free. Ooh yeah. His eye. Are you gonna sing with me? No, you can't. Come on, let's do this. Let's kick a beat. I need you to make a beat. All right. That's not a good beat. How can I love somebody else when I can't even love myself enough? That's it. Anyway, thank you for your time. I think, like I said, I think you're doing a great job educating our silhouettes and keeping our silhouettes safe.
Everyone's saying
Thank
thank
you
you.
so much, Dr. Jones, for having us. And yeah, we really appreciate you.
Thank you.
Thank you. All right, so we're tuning out. Everybody have a beautiful day. Enjoy.